Postpartum bleeding, also known as Lochia, is inevitable whether you had a cesarean birth or you had a vaginal delivery. In this video, I'll be explaining everything about postpartum bleeding, the things you need to expect, what you should do to avoid infection down there after delivery, and every questions you are probably asking. Stay tuned, don't go anywhere, I'll be right back. Hi everyone, you're welcome back to my YouTube channel. If it's your first time here, this is Motherhood Journey with Abiola. If you like this video and you want more content like this, ranging from pregnancy to postpartum lifestyle and motherhood in general, like this video and ensure you subscribe to this channel and turn on your post notification so you don't miss an update. Let's build a team of mothers and even fathers that make a difference. Postpartum bleeding, also known as Lochia, consists of blood, mucus, uterine tissue, and other materials from your uterus. It looks like your menstrual period discharge, but it is not. Consider it as your body's way of getting rid of extra blood and tissues that helped your baby grow in your uterus. How long does postpartum bleeding last? You need to understand that you would go through 3 stages of postpartum bleeding. At the initial stage, you have the Lochia rubra. At this stage, you will notice that your blood flow is dark or bright red in color. This is also the stage where bleeding is heaviest, and this stage lasts for about 3 to 4 days postpartum. You may also notice small blood clots, but if you have a large clot larger than the size of golf ball, then you should talk to your healthcare provider in order to be checked. Then after the first stage, you move to another stage called Loia Serosa. This stage lasts for up to 4 days to 12 days postpartum. And at this stage, you can expect pinkish brown discharge. Also, your blood flow must have subsided at this stage, and you will have less blood clots or small, very little blood clots in your discharge. Then you move to the last stage called Loia Alba. At this stage, you have yellowish discharge. You should, at this stage, have no blood clots at all. At this stage, you may have spottings every few days. Sometimes you might not even have so much on your pad, because this stage is just the last stage and your blood flow is subsiding. Now, this stage, although our bodies are different, but this stage lasts from 12 to 6 weeks. Some people's blood flow stops before 6 weeks, while some people's own might extend further than 6 weeks. Before I continue, I must say blood flow has to go from rubra to serosa, then alba. If you have it backward, then you should see your healthcare provider to be checked in order to know what exactly is going on in your body. So what should you expect when it comes to postpartum bleeding? Firstly, your postpartum bleeding, also known as Lochia, should smell a lot like your menstrual discharge. If you have a foul smell or a fishy smell, then you should see your healthcare provider immediately. Also, Lochia typically lasts for about 6 weeks, but our bodies are different, so yours could be shorter or longer. There are a lot of factors that can affect Lochia and increase your blood flow, but you might notice more flow if you engage in physical activities such as climbing stairs and walking. Also, while you are just standing from lying position, you might notice more blood flow. Another thing you can expect while having postpartum bleeding is mild cramping and uterine contraction as your uterus goes back to its original size. You may also see blood clots, very small one, in the first few days of your postpartum bleeding. But if you see any clot larger than the size of a golf ball, I mentioned that earlier, it's very important. If blood clot is larger than the size of a golf ball, then you should see your healthcare provider immediately. Do not wait. So how do you take care of yourself during this postpartum bleeding period? The first thing is for you not to insert anything into your vagina. Do not use menstrual cup. Do not use tampons, as they can introduce bacteria to your uterus and cause infection. Also, ensure you make use of maternity pads because these ones are more absorbent and cause less irritation. Thirdly, wear pants and underwears you don't mind ruining, so that in case if you have blood stains here and there, you can still make use of it. You know that those underwears are meant for this period of time. You are not using them again after you are done with the postpartum bleeding. 4. Also ensure you change your pad every few hours, say like 2 hours, so that you are not at risk of infection. Now, a few tips before I go today. Run to your doctor immediately if you discover any of the following while going through postpartum bleeding. If you have a greenish discharge, if you have a foul-smelling discharge or a fishy discharge, if you are running temperature, if you are having chills and fever, run to your doctor immediately. Also, if you have so much blood flow that you have to change your pad every 1 hour and flow is not subsiding, it continues like that and keeps gushing out, or you have a faint feeling, then you should see your healthcare provider immediately so that you can be checked. And that is all I have for you today. Thanks for watching this video. See you in my next video. Bye.